Good afternoon, everyone. My name is Sarah Ripp, and I'm the Assistant Director for the Latin American, Caribbean, and Iberian Studies program here at UW-Madison, and we're really pleased to see all of you here today. Today is my pleasure to introduce our speaker, Dr. Douglas Dulli. Dr. Dulli is a recently retired UW professor of neurology who has been teaching for the School of Medicine and Public Health for the past 27 years. He has participated in over 30 short-term medical missions, also known as Brigades, over the past 21 years. These missions have taken him to various countries, including Honduras, Guatemala, and Belize, which are some of the places he'll be focusing on for the presentation today. In addition to his involvement in the aforementioned Brigades, Dr. Dulli also recently retired as the medical director for the MEDIC student-run free clinic in Madison, which I understand has 6 locations across the Madison area. We thank everyone for joining us today. We do plan to leave time at the end for questions, which you can leave in the chat box, or you may unmute yourself and ask your question that way. So I think I will turn it over to Dr. Dulli and let him take it away. Thank you so much for joining us.
Thank you, Sarah. Thank you, everybody, for coming. I'm humbled that so many people are interested in my nostalgic overview of my short-term medical missions. I'll introduce this by saying that this adventure fell into my lap at the end of the 20th century. At the time, I was on the admissions committee, and I was reviewing applications, and I was struck with the very well described medical mission to Honduras by this applicant who went with a group called MEDICO out of Georgetown, Texas. And geez, it sounded really good. And he said, well, the director is a neurologist. So I called him, and one thing led to another, and I found myself in the middle of Intibucá, Honduras in September of 2000. And it was such an incredible experience. And I think that the poverty was much more than I thought, and much worse than I thought. The conditions were horrible and made worse by Hurricane Mitch. And the amount of work I was doing and the fact that I was completely over my head. One of the colleagues that I was assigned to as a babysitter, he spoke fluent Spanish and Portuguese. He was a pediatrician. Couldn't have been a better fit. I was an adult neurologist who spoke no Spanish at all, and clumsy and completely freaked out. And his comment to me was, "Do you know what you're doing?" And we became very good friends in subsequent years, but I always remembered that little bit of humility. It was an incredible experience. And what I saw there and what I experienced there paradoxically led to this incredible inspiration for doing more. Maybe not trips quite that difficult, but that was just something I felt I had to kind of infuse into my life. Since then, I've done over 30 trips, not all of them medical brigades. Some of them were goodwill missions especially into Africa. Some were in residency rotations, especially into Addis Ababa, Ethiopia. Some of them down to Ecuador. The ones I'll be talking about, none of that today. I'll be talking about some of the short-term brigades, typically lasting 8 to 10 days in Honduras, Belize, Guatemala, and at one time Haiti. Even that's exceptional because that was actually a rescue mission. Of course, that's not Central America. That was a rescue mission that I jumped on with Notre Dame. Can I advance this? Good. So a couple of introductory comments about this. And I think one thing I want to sort of talk about is the idea of practicing tropical medicine. The word comes from the tropics, which of course refer to that area of latitude 23.5 degrees north and south of the equator, called respectively tropic of Cancer and Capricorn. This is a very special part of the Earth in the sense that the majority of the Earth's population live there. The overwhelming majority of the poor people of the world, of the impoverished people, the underserved lived in this area. And you can see that just by looking at a map stratified by income or GDP, the vast difference in income, the vast difference in incomes between these areas and what we see in the so-called developed world. And you'll also see these areas of red that are not so much present in the Western Hemisphere, with the exception of Central America. Oops, I keep hitting the wrong button. So for the large part, tropical medicine refers to the disease of poverty. It is true, it's largely an infectious disease practice, but largely, but the other side of that is nutritional disease, and therefore it's the disease of poverty. 10% of the world use 90% of its resources, while 1.4 billion people make less than $1.25 per day. This is the so-called bottom billion. And it's difficult to imagine that 50,000 people die each day due to malnutrition or disease, and 30,000 of these are children. 6,500 children die each day just due to diarrhea. The countries I'm going to talk about, Belize, Guatemala, and Honduras principally, are in the lower strata, not the lowest. Haiti is really about the most underserved country in the world. But you can sort of see that this affects the infant mortality, 50 out of 1,000 compared to our 5.9. It also affects the median age. In fact, 60% of, 40% of people who live in Belize, Guatemala, and Honduras are less than 15 years old. That number is down to 50%, or up to 50% in Haiti. There are different types, and I apologize for using these terms interchangeably. We use the word brigades, kind of implies a short-term mission. And so that's why we often use the term brigade as opposed to mission in terms of much longer stints. The first type I was on one in my life was a rescue mission following the earthquake in Haiti in 2010. I've got one or two slides from that. That was pretty difficult to see. But that's something that Médecins Sans Frontières, that's their stock and trade. They're an incredible organization. If you have any opportunity to meet with them, they sometimes do recruiting drives around campus too. The other type is a goodwill mission, and that is where there are actually structures in place. We often go as specialists, or that kind of fits a little bit what I do as a consultant. So I did that in Vietnam and Ecuador. That was kind of fun, but that's not really the brigade in terms of going up into the mountains and things. There's also a teaching mission, and that's kind of what I've been doing in the last 5 years. Is really restricted myself to that, where we take allied medical students and allied health students into little villages, often with sponsors. Well, our sponsor is the University of Wisconsin. Private organizations can also link with the sponsor. My favorite by far is Save the Children, and the Save the Children will tell us where to go. So that's like a private community-based organizations. They're also sometimes sponsored by church groups and whatnot. And you've probably heard about them in your communities. There are three, regardless of whether it's teaching, rescue, goodwill, whatever, there are three cardinal rules. And one is that we are to provide complementary medical care. So the idea is not that we're going to come down and show everybody how to really do it. That's really a terrible cultural invasion. And so we try to support what care that they have in place and defer to them, if you will. The second thing is that there's assessment of people, especially when we have sponsors, the general health of the people and their needs. So oftentimes this involves being able to refer surgical cases back to the United States or into the larger cities in the host country. And third is to provide services that are not readily available. This can include something as significant as plastic surgery or just dental care. Many patients we've seen in rural Honduras have never seen a dentist, have never seen an optometrist. And so that's something we can do that's really helpful. When you would see a person who has never, we actually had a patient who never saw the mountains of Honduras, and he put his glasses on for the first time. He goes, "There's mountains here." And that was such a profound intervention. Oh, I keep hitting the wrong button. Okay, so with that in mind, let's do my little slideshow. As I looked at these slides before my talk, I found that I took too many pictures of Mount Atitlan. This is in San Lucas, or it's many towns, but you see this best from San Lucas, Tolaman in central Guatemala. You might be aware of this, might not be so aware of it. Central America is extremely mountainous. So is Haiti, but Central America is quite mountainous. The peak you're looking at with a little smoke coming out, which that is volcanic smoke, is 12,000 feet high. And it's really pretty awesome to travel there. Here we are arriving in Honduras. This is about 20 years old, this picture. And these are medical school aspirants, I think. I can't remember because it was such a long time ago, but they're all excited and a little apprehensive about the country they're going into. This is with my medical students in villages in Guatemala. If you look at this young man here, this is kind of illusory. This young man is standing in the middle of the swinging bridge. I mean, rocking back and forth. And although you can't appreciate it so well here, he's actually looking nearly 100 feet down at the brook. I hate this bridge. Every time I cross it, I hang on to both wires for dear life. And the brave ones are the ones that can walk across it, like this guy here just taking pictures. I would never be doing that. Scares the heck out of me. This is a pretty awesome scene. This is about 3.5 months after the earthquake in Haiti in 2010. You can observe the building cracked in two, and it's about 20 miles from Port-au-Prince, where we landed, to Leogán, which was virtually at ground zero of the earthquake. About a 20-mile trip took us 2.5 hours. We could have almost run that fast. Much more pleasant scene. Our medical students arriving at San Lucas at the mission there. The mission itself is about 60 years old. It was built up by a Father Gregorio Schaefer, who was a best friend of a Stanley Rother. If you know Stanley Rother, you'll know that he's up for sainthood as a martyr in Guatemala. We were right in that area. This is the kitchen and meeting room. So the way this mission works, they host a lot of short-term brigades, and they're not just medical brigades. He'll take anything from high school and college students, medical students, and just medical missions or medical brigades in there. And we all have to do the cooking, do the cleaning, all these sort of things. So we're given assignments when we go there, but it's extremely pleasant. And the San Lucas is at about 6,500 feet up, so the weather's always very pleasant. It's of course near equatorial, but at that altitude, it's just very pleasant. Some slides on the people and environment. For those of you that have been there, can appreciate this with me, that this is some of the most beautiful landscape in the world, and such a paradox with the horrifying poverty you see there. I've always been awed when I look at the mountains of Honduras and Guatemala. Oops, I hit the wrong button again. Dang on it. This is, I seem to go through, yeah. This is Lake Atitlan, which has several towns surrounding it. This is, we're seeing it from San Lucas, and actually at a little restaurant there. You can see it, the shadows in the foreground, but such a lovely, lovely sight and pristine water. This is Santiago, where Stanley Rother's from. This town, San Lucas, as well as this town, Santiago, are largely populated by Indian tribes. And many of the people living there don't speak Spanish or English. They speak Kichimayan, Kichijudal, and Tuchijudal. Those are 3 languages that are spoken in those areas, and some of them have rudimentary Spanish at best. Another view of Mount Atitlan. My bucket list is to climb climb this thing and go into this little tiny house way at the top. It's a 2-day trip, but I'm going to do it one day. Another view of San Lucas, just a gorgeous little place to live. We're at sea level looking at this. This is actually in Belize. And I'll tell you that if you do a medical brigade in Central America, it's crucial to know what altitude you're going to be doing it at. If you're at sea level and near the sea, which many of the brigades go to, these little guys will be your constant friends or nocturnal friends. They kiss to you at night. and I never had one try to sell me insurance. Doggone it, sorry. Another view of Atlan. Kind of an interesting sight here. So we see an older gentleman, about half the size of myself, carrying a load that I can't imagine carrying. And this is what he does day in and day out. That's pretty incredible. The other thing to see on the right side of the screen is the taxi cab service called a tuk-tuk. Now, tuk-tuks are ubiquitous in the developing world, and they're little 3-wheeled vehicles that you can go from one side of town to the other for about, in San Lucas' case, about 3 quetzals, which is about 35 cents. They're very pleasant to ride in. They don't go that fast. This is wash day, Lake Atitlan. I'm struck by the fact that if you went back in time 500 years, at a little time machine, maybe off to the left, and then walk back out, you would see the exact same site, except the buckets wouldn't be plastic. This is Azacualpa, Western Honduras, lower altitude, about 2,500, 3,000 feet. And people actually were pretty healthy in this town. You could sort of see they look much healthier than, it was a pleasant visit, a crowded visit. We were busy that week. Well, it doesn't work all the time. And then I advanced, and it advances 2 at once. Okay, 4 at once. If you go to Central America, you'd see this as tourists for sure, but when you're doing medical brigades, your tourism, if you will, is much more intimate. You're with the people, you're doing things with them, and you become impressed in the predominance of children, beautiful little children everywhere you go. This is especially true in the medical clinics, but it's true all over town, everywhere you go. There's so many children, in fact, to conduct a clinic, the medical students will take shifts where instead of caring for patients, they'll babysit the children so they don't run underfoot in the clinic. And here's some assistants. Sometimes we'll put them to work too, but that doesn't work out very well. They turn out to be more of a nuisance than anything else. A beautiful little nuisance, but a nuisance nonetheless. Translation in Central America is a big deal. Consider these translators. She and she both speak excellent Quechua Mayan and Spanish. She speaks only Spanish, and she speaks all 3 languages, English, Spanish, and Quechua Mayan. So if we have a patient who's particularly ill or higher priority, we all scramble to see if we can get the chief translator who can do all 3 languages. If not, we have to translate English to Spanish, then Spanish to Quechua Mayan, then Quechua Mayan to Spanish, and then Spanish to English. And you can imagine that can breed confusion in the history taking. It's a very special translator. This is my son, who functions as a translator in a trip to into Baca, Honduras, but he's also a Catholic priest. And so we went to a village that had an ancient church, but they hadn't seen a priest in 3 years. So we were not the stars of that mission. My son Brian was. He was the star. These are 2 other assistants, but they were anything but in my mind. And the students kept running off to play with them and stuff. And I tried to get them fired, but it didn't work. They were just too cute. I get funky results when I try to advance. Oh, here we go. Okay. Here's some assistance I had in Haiti. Now, this is a little scary looking as I look back at it from now 11 years in the past. I had little children in a pharmacy where these medicines were potentially lethal, but they were wonderful, great assistants. They were translators and they spoke beautiful English and French. So I was able to get quite a bit of service. You can sort of see that Haiti is, at least down near Leogane, it's pretty warm. It's about 100 degrees that day. She's at the time aspiring to medical school, and she this was an assistant again on a trip to Intibucá, and she was a wonderful assistant because she was so interested in the medicine. I think her sister was in the same situation. This is her sister on the left side with a family, a mother with her handsome young men who are all, or handsome young boys who are all soccer stars. Football there is, or soccer is a gigantic endeavor. I guess it is throughout the world, but you really appreciate how important it is down there. These are assistants in Haiti, both of them nurses actually, and this is a surgical. We were doing our post-op care. This is one of my most important assistants. She was the chief chef. She was a chef for my first 7 or 8 Honduras missions. And she had culinary skills that were just out of this world. Her name was Ferma. I never spoke a word of English. And as far as I can tell, the only thing she ever actually said to me was cafe. This is the founder and director of MEDICO. Her name is Linda Peters, and she's become quite renowned for, she's a high school graduate who just with passion built up this wonderful organization serving Central America and primarily Honduras. She's 77 years old in that picture, and now at age 81, she can still climb mountain pass. My daughter, Jessica, was a pharmacist in Minneapolis. Special shout out to Save the Children. If you're looking for a special charity to serve the underserved and the impoverished, Save the Children is wonderful, and they do so many things. And one of the things they do, whenever we had a sponsor, whenever I was making a medical mission with MEDICO, I would always ask, what altitude am I going to, and who's the sponsor? Because if the sponsor was Save the Children, I knew I was going to be in for a very rough week, because they would always send us to the poorest of the poor. Moving next to students and teachers, it's a wonderful mix doing medical brigades with students. They provide so much incentive, idealism, and just raw emotional power to these things. It just makes a lovely trip. They love what they're doing, and they just their energy is absolutely boundless. The conduct of the clinic is then in a teaching clinic is that when we can do it, the student will see the patient first, even if that patient's only 2 months old, as in this case, and then she will present it to the attending physician. This is Dr. Svensson, who emergency physician and really well versed in tropical medicine. And then they will develop the plan, and they will go, and he will go see the patient, and they will implement the plan of care. Shoot. Okay. This was my mentor for the first 10 years of doing medical brigades. This is Dr. Salvador Perez, who's a professor of pediatrics in San Pedro Sula. And he, his skill in caring for patients was unparalleled. One of the wisest men. He taught me so much, even though, like Ferma, he didn't speak a word of English. That's not fair. He spoke very broken English, but he also spoke medical, and so we have enough cognates in the world of medicine that we understood each other quite well. He's much older now. I think this thing is about 4. This picture is about 4 years old, but one of the most valuable people I've ever had the honor to meet. Another amazing mentor, Dr. Nick Costanza, I'm saying that right, an internist in Los Angeles who was actually born and raised in Mexico. His knowledge, again, his particular area of interest is tropical medicine. And so he taught me so much on those trips. I'm moving now to patients in clinics. And this is a young girl. For those of you who are interested, this is strabismus. You can see she's got a left eye esotropia and a very beautiful face. You can also see the clinics were a little bit jury-rigged, let's say. We pushed furniture aside. We made do with whatever we could get away with. And so that's kind of the way clinics are. Setting up is always a big deal. And if it looks pretty disordered to you, it's because we often do the setups in the same day as the clinic. We go out to villages from our main site and then see the patients that way. A typical clinic, a little bit more organized here. Again, lots of children, lots of mothers and children are predominant, predominate the demography. Some of the mothers, as you can see here, are quite young. Teenage mothers are common. Another typical scene, this time in Belize, near sea level. Beautiful young children, young women who are mothers. Very common. I apologize for these next two slides, but some of the commonest things you see were as a result of not just infections, but also nutrition. This is actually scabies, which is almost ubiquitous there. Body worms or parasites, what's called parasitas. Government programs are in place to keep children with bebendazole and albendazole, but even in those circumstances, we have a lot of breakthrough. This is not parasites, but scabies is ubiquitous there too. Another pretty awful stuff. This is actually diabetes combined with venous stasis, and the black you're seeing is a superficial necrosis due to poor circulation. The mother with her baby. This is in Belize. Again, I'm not advancing. The student in the right, just all she did was say, "Segunda," or next. And she brought a family of 4 little children. So the precious parts of this photo are the look on her face of shock when she sees what her next quote unquote patient is. She's actually seeing all 4 children, and the look of the mother saying, "Can you handle this or what?" That's the way our clinics went. We often see entire families, and they might have relatively trivial complaints, but they really want to know: are their children healthy? Are they normal? Is there something that they could do to make their children do better in school or whatever it is? And so they commonly would bring their children just to have them seen by the doctors. Oh, a happy outcome to a patient clinic, a patient encounter. So these trips would foster a lot of camaraderie among us and stuff. And sometimes the work was not so tough, a nice day in clinic. Sometimes it was just brutally hard. And getting together meant all the more when we do that. This is actually from my Goodwill trip down to Ecuador. I think it's a Gila Monster, but whatever it is, it's kind of scary looking. It's amazing how fast these guys can run. They can scoot across a street in a flash. This is one group, a typical med school group down in San Lucas Talama with Lake Atitlan in the background. And we had a wonderful dinner at this lovely restaurant. Cost about $4.50 for a feast per person, of course. This is Azacualpa in western Honduras. I was just so taken aback by they were so happy to see us. They made a big celebration out of it. And this is a dance the children performed. It was just very moving. They're just expressing gratitude and hospitality. Typical group in my MEDICO is about 20, 22 of all different skills, including dentistry, optometry, surgery. Not too many surgeons. We only do minor surgery in those trips, and most of it's general care and support. My daughter, she survived a trip in Honduras. We were in, I can't remember what town we were in. So that's kind of it. I think that the drawing some conclusions on these medical brigades. What first comes to mind is whatever I've given of myself to do these things, I've received so much more that I have to conclude that largely my motives are selfish in nature. The adventure, the beauty, the learning, it's just been out of this world. And using this as a teaching platform has even been more wonderful. So the rewards, short-term medical brigades give you intimate encounters with exotic and beautiful lands and cultures in a way you never could just as a tourist. The educational, you get exposure to conditions that are rarely seen in the developed world, or even if you do see them, you don't see them to the extent that you see them in Central America. The group develops a very tight camaraderie by the end of the week, and even during the week. And the patients truly express gratitude. They really do appreciate their being there and stuff. And I think that to use that in terms of the goodwill it generates and be respectful and humbled by their own culture is you gain even more. One thing you appreciate when you travel to the developing world, and especially in the context of a medical brigade, where you've been in these intimate encounters, you realize that your citizenship in the United States is not a birthright, it's an accident of fate. You happen to be born in the United States, you happen to be a United States citizen. Why is that? And I've never quite had an answer for that, but I happen to be much of the development I've had as a person and as an education. Well, it was kind of an accident. It could have so easily gone the other way. I could have been born in Honduras. So it's important to realize things like that when you think about, how much good are you doing? What kind of, are you really the hero, the savior? Our interventions, just for a reality check, our interventions are limited by the very small infrastructure. It is improved if you have Save the Children, another good sponsor. University of Wisconsin's been very good at sponsoring our missions as well. And these things are erratic. They're not a structure of medical care. They're medical tourism, if anything, but they do provide certain people certain benefits. And if you realize that, and not take the attitude this is medical care, to really do that, we have to support an infrastructure that promotes self-determination of the people we're serving, and that is being done. But it's but it lags, and so we're kind of filling in gaps as we go. It's very important to be respectful of the local culture. Very important to not get on your high horse and think, well, I'm so knowledgeable in medical care, or it's my lifestyle, some sort of birthright, and And you have to just realize that that you're on. Well, we used to say you're on another person's land, and I think that's really important to understand, to do that, to avoid these controversies. Sometimes these medical brigades, your help is misconstrued because it seems like you're just past the reasons you're so healthy is because you take pills all the time. And it's just, I found that to be very disheartening at times. So I think, are these a good thing to do? I think they are. And I think with all the advantages and disadvantages and controversies, I think the best way to describe the benefit you can provide is the parable of the boy and the starfish. For those of you who haven't heard it, It's a story about a little boy who sees the tide going out to sea and all these starfish stranded on the shore. Realizing they're going to die because of this, he frantically runs down to the shore and starts throwing starfish one by one into the sea. An old fisherman is sitting there and chuckling at this display, and finally yells at the boy, "Hey, little boy, what do you think you're doing?" And he says, "I'm going to save these starfish," the little boy says. He goes, "Look at the thousands of starfish along this shoreline." He says, "How do you think you're possibly making a difference?" And the little boy holds up the starfish. He goes, "Well, it makes a difference to him." So these missions do enhance educational benefits. They do enhance your own cultural benefits as well. They do provide you an incredible view of the world that you could not possibly get just living in your developed world. We have the tendency to think of our world around us as what we see. And so when you extend your vision into a trip like this, you realize how vast it really is. There's a continuing pressing need for global health efforts in an underserved developing world. I'm not naive to think that these are addressed by short-term medical brigades, but they are sincerely addressed. And if they're culturally respectful, you can provide a difference to one. And that's it.